What is vitamin D and how much should you be taking? In this video, we will answer those questions and more. Stick around till the end to find out if you're deficient or potentially overdosing on vitamin D. Before we get into that, smash the subscribe button. If you want pertinent information on gaining and maintaining your health, we upload videos about those topics on a weekly basis. What is vitamin D? Vitamin D is a fat-soluble vitamin that plays a vital role in many bodily functions. Vitamin D is essential for calcium absorption and bone health and supports immune function and cell growth. It comes in two forms, D2 and D3. D3 is the form that is most commonly found in supplements, as it is more bioavailable than vitamin D2. Vitamin D is having a moment in the sun. Low levels have been linked to an increased risk of everything from heart disease, diabetes, and cancer to mood disorders and dementia in recent years, according to research. Vitamin D supplements and testing kits are becoming increasingly popular. Unfortunately, this vitamin D increase isn't all sunshine and lollipops. Some consumers are taking too much of the supplement. Researchers examined national survey data from 1999 to 2014 and discovered a 2.8% rise in the number of individuals taking potentially harmful dosages of vitamin D. What is the recommended dosage of vitamin D? The recommended daily allowance for vitamin D is 600 IU per day for adults. However, many experts believe that this amount is too low and that most people need more. The Vitamin D Council recommends taking 1,000 to 2,000 IU of vitamin D per day, and some experts believe that even higher amounts may be necessary. So is it 600 or 2,000 IU? Well, the truth is it varies depending on age, sun exposure, and health status. How much vitamin D does the average person need? Let's break it down. 400 IU per day for infants aged 0 to 6 months. The maximum safe upper level of intake is 1,000 IU per day for children aged 0 to 6 months, 400 IU per day for 6 to 12-month-old. Maximum safe upper level of intake, 1,500 IU per day, 600 IU per day for ages 1 to 4 years. Maximum safe upper level of intake, 2,500 IU per day, 600 IU per day. For ages 4 to 8 years, maximum tolerable upper level of consumption, 3,000 IU per day, 600 IU per day. Maximum tolerable upper level of intake, 4,000 IU per day for adolescents. Adults may use up to 4,000 IU per day, 800 IU per day. Maximum safe upper level of intake, 4,000 IU per day for persons over 71 years old. As a rule of thumb, the Vitamin D Council recommends that healthy adults consume an average of 2,000 IU of vitamin D each day. More if they don't get enough sun. A common question is, can I get enough vitamin D from the sun? Probably the best way to get vitamin D is through sunlight exposure. Just spending time outdoors in the sun can help improve your vitamin D levels. But how much sunlight do you need? In general, fairer-skinned people will need less time in the sun than those with darker skin. The time of day also matters. The sun's rays are strongest between the hours of 10 a.m. and 3 p.m. And finally, the season matters. During the winter months, when the sun's rays are weaker, you may need to spend more time in the sun to get enough vitamin D. Individuals with darker skin, in particular those over the age of 60, produce less vitamin D in their skin. Seasonality and geography are also important since vitamin D production varies with distance from the equator. If you are fair-skinned, keep in mind that the same thing that helps your body create vitamin D can also cause DNA damage, sunburn, and genetic mutations. This might lead to wrinkles appearing and raise your risk of skin cancer. You might be wondering, what are some other sources of vitamin D? You can also get vitamin D from some foods. If you want to include vitamin D-rich foods in your diet, add foods like eggs, salmon, mushrooms, and fortified dairy products. If you're not getting enough vitamin D from sunlight exposure and food, you may need to take a supplement. The amount of vitamin D you need from a supplement will depend on a few factors, including your age, health status, and whether you're exposed to sunlight. Earlier in this video, we went in depth on how much IU, international units of vitamin D you need per day. If you've made it this far, go ahead and give this video a thumbs up, subscribe, and tap the notification bell so you don't miss future health facts. You're going to need to stick around till the end to find out the major benefits of vitamin D. Can taking too much vitamin D3 hurt you? Vitamin D toxicity can occur at any level, and even small doses might be fatal. Vitamin D overdoses are not unusual, and they can be dangerous. even if there are no symptoms of overdose. What are the signs that I took too much vitamin D3? The signs of too much vitamin D include nausea, vomiting, poor appetite, constipation, weakness, and weight loss. If you experience any of these symptoms after taking vitamin D supplements, stop taking the supplement and call your doctor. You may need to be treated with intravenous fluids and medications. Your doctor will likely order a blood test to check your vitamin D levels. They may also recommend other tests to rule out other possible causes of your symptoms. You're probably asking yourself, how common is vitamin D deficiency? Vitamin D deficiency is actually quite common. In fact, it's estimated that 1 billion people worldwide are deficient. And there were a few reasons why. For one, we're spending less time outdoors, which means we're not getting as much sunlight exposure. Another reason is that our diets are often lacking in vitamin D-rich foods. In closing, what are the benefits of vitamin D? Vitamin D plays an important role in bone health. It helps the body absorb calcium and phosphorus, two minerals that are essential for bone development and maintenance. Vitamin D also helps to prevent osteoporosis, a condition characterized by weak and fragile bones. In addition to its role in bone health, vitamin D is also thought to have other health benefits, such as reducing the risk of some cancers, heart disease, and type 2 diabetes. It's important to speak to a healthcare professional before starting any supplement regimen. If you found this content valuable, consider sharing the video with someone who needs this information. And for more videos like this, click on the next health fact video that YouTube is suggesting in the bottom left corner. Till next time, stay healthy and get the facts.